When you realize that over 80% of Latinos live in non-attainment areas for clean air standards and over 72% of African Americans, you understand perhaps why there's such glaring health disparities, why there's such an asthma epidemic, and why it is so important for us to clean up our air. You know, I began organizing around the North River sewage treatment plant in 1985, 86. And about that same time, the United Church of Christ Commission for Racial Justice developed a report called Toxic Waste and Race. And that report looked at where toxic waste sites are sited around the country. And it concluded that the primary indicator of where a toxic waste site can be found is a community of color, and secondarily, a low-income community. That study has been replicated 10 years later by the Commission for Racial Justice. It has also been replicated by other academics throughout the country. Daniel Faber at Northeastern University up in the Boston area conducted a similar study that showed that toxic waste were primarily in the Massachusetts, were primarily in communities of color as well. It's also interesting that Daniel Faber, the same professor, conducted a study called Green of Another Color that found that 0.5% of all money that goes to the environment goes to environmental justice. So that 0.5% of all environmental funding goes to environmental justice. So that again shows you how under-resourced these community groups are who are trying to uphold the quality of our environment. So yes, race plays a key role. We know that communities of color are often targeted for pollution. And we know that because over the years we've been able to find and liberate memos from corporations and industries that literally say, let's go to this particular community. We don't think they're very politically active or powerful. They probably don't have a lot of information or education about these issues. So yes, we know that when industry is looking to put bad stuff, they go to communities where they think they'll have the least resistance, and those are going to be the ones that are poor and less educated about environmental concerns. The issue of environmental exposure and health outcomes has been the question the community has always wanted to know from our early days of organizing. And as a result, we have developed partnerships for the past 12 years now with the Columbia Center for Children's Environmental Health and other research centers at Columbia and at Mount Sinai as well. That work has been very important. The Columbia Children's Center work, I was involved in helping to write their first grant, and they are doing the kind of investigation that is exactly what we want to know about. Indoor air quality. What are we being exposed to? Ambient air quality. How are we being exposed? What does it mean? And unfortunately, what it means is low birth weight, developmental delays. It means that children are not getting they're not getting that good start in life that they need. They're starting at a deficit.